Go. Oh, it's all out of
Hi,
balance.
everyone. You've just interrupted Deb doing her hair.
Doing my hair, I know. I don't look at myself all day in the mirror, like after brushing my teeth and washing my face, and then I suddenly look at myself like, seriously, I've been walking around like that all morning.
That's normal, isn't it? Honestly, I have days where I absolutely do not even, I've run my fingers through my hair and that's pretty much it. Although I do try to put my eyebrows on because I feel a little bit more complete when I put my eyebrows on. But anyway, my name is Sarah HUnstead. I'm a paediatric nurse, a mum of 2 and founder of CPR Kids. And I'm joined by Dr Deb Levy, who is a holistic paediatrician and a wealth of knowledge. And we bring Facebook Live and YouTube Lives to you every week on child health subjects. And today we are going to be talking about poo, because it is Deb's favourite subject to talk about. And, being a nurse as well, there is no subject that is taboo. Let's talk about poo. So, Deb, can you introduce yourself to everybody who hasn't joined in before? And yes, we are usually this silly.
So exactly as you said, Sarah, every week we get together to go through some common childhood illnesses and topics that you ask us for. So by all means, contact us either in our DMs or type something in the comments here to let us know what you want us to teach you about and talk about, because what we both believe is that the more you know as parents, the easier the journey is, and certainly the less stressful. Mm-hmm. Exactly as Sarah said, again, I'm a holistic pediatrician. I'm also a mum of 2 young girls as well as 2 dogs who are in the room with me. So you'll have to excuse any noise. You'll also have to excuse me coughing and spluttering, because you may have wondered where we've been for the last couple of weeks. I know Sarah's been posting some reruns, but I've been quite unwell. So excuse me if I have to cough and splutter.
Oh, no, you poor thing, Deb. And as has, I think we can't turn around
the whole of Sydney.
Exactly. The whole of Sydney, let alone the rest of Australia as well. And that's just how it is at the moment. This will, come to an end. But at the moment, we are in the thick of it. And if you hadn't had influenza or another one of those respiratory viruses that are going around at the moment, you're very lucky. Hopefully you won't, but you might end up with it too.
And as an aside, we've actually done a couple of lives around it recently. We did something on bronchiolitis, and I've also just recently posted something to my Instagram. You can see my handle just down below here at Dr Deb Levy. So go ahead and get your knowledge up on par for that.
Yeah, absolutely. Thank you. So poo, everybody does it, and as a parent, you start to have a closer relationship with poo than you ever have before. You look at your child's poo, you monitor it, like you do things that like you just never thought you'd end up doing before you're a parent. Like
it's the photographs, Sarah.
Yeah.
No, it's the photographs. That's the thing that I cannot imagine any parent anticipated doing.
Yeah.
And I see them.
Yes. Well, that's good. That's a good thing. You want to see them, but, I remember being sent photos around just, with mums who are having babies around the same time with different poo going, is that normal? Or what's that in the poo? That looks like a piece of Lego, things like that, we tend to share and overshare. But it's sometimes, it's something that's very important, with our poo. And I guess one of the things is how do you know what's normal and what's not, particularly if it is the first child that you've got? And often there are little surprises that end up happening that are completely normal, like when you first time you give your child bananas, watch for the poo. It looks like it's got little threads or worms in it, just saying, but it's not, it's banana. That's one of the things that we get told a lot about, and also sultanas, but we'll get to that later. But Deb, what I'm hoping we can do today is let's go through the age groups. We'll talk about newborns. We'll talk about, around the time when we're introducing solids, and also toddlers. So let's start with the newborns. What can we expect of our newborns' poo? What should it look like, and how often should they be doing it?
Okay, so the thing with newborns is we want to watch for that very first poo. That's something called meconium. It's thick, sticky, very, very dark, almost a dark green, black color. and that should be passed within the first 24 hours. We become concerned if it's a little bit later than that. And so that's also when you talk about sometimes babies getting distressed during delivery or in utero inside mum's belly, sometimes they can actually pass that poo at that time, but otherwise it should be passed soon after birth. Then they go through what's called transition poos, and really it means it's transitioning from that meconium to a normal newborn baby poo. And what's a normal newborn baby poo? It very much depends on whether they're breastfed or formula fed or mixed fed.
Okay. Right.
Formula fed poos are often a little easier in terms of they don't smell as bad. Sorry, did I say formula? I meant breastfed poos. Sorry.
Yeah. Okay.
Sorry.
So breastfed
poos do not smell as bad as formula fed babies. So they're not very smelly, and they're typical, we call it mustard, like a grainy mustard, textured consistency. And with an exclusively breastfed baby, the amount of pooing that they do is incredibly variable. So there's this overarching feeling that breastfed babies cannot get constipated. And certainly that plays out quite true. So you can have a breastfed baby who's pooing after every breastfeed, and you can have a breastfed baby who's pooing once a week, and both can be entirely normal. So it's never a case of, even though I'm fascinated by poop and it gives us such an insight into our child's health, it's never just the only part of the puzzle when we look at a child's health. So, that's a breastfed poo. With the formula fed poo, again, it's variable. It's often a little firmer, and it's often smellier. It can still be the same color. The question I often get asked, Sarah, is a green poo normal?
Yes.
So the short answer is usually yes. Usually yes is normal. The initial, I'm not talking about that initial meconium, which is that dark green. I'm talking about a child who's, on formula or maybe a couple of weeks old or whatever, and suddenly has some green poos. It can be entirely normal. It's often just indicative of the fact that the poo, the passage of the poo through the gut is a little bit faster than what it has been, and we're seeing something called bile in it. It can be because a breastfed baby is having more fore milk or hind milk, or that's quite a controversial topic in some circles. But I think the message is if your baby is otherwise totally well, no issues, and just has a green poo, I wouldn't be overly concerned. But as with all these things, if there's any kind of a change, you should always be chatting to your healthcare provider.
Absolutely. And what about the formula fed babies? So you've talked about the frequency with a breastfed, but what about formula fed? Are you expecting them to poo every day, or is it the same as a breastfed baby where it could be once a week?
Yeah, so formula fed babies can get and often get constipated. So it's important to watch for that. Ideally, you want regular bowel movements, so a few a day for a young baby. Certainly if they're not doing one every day, and certainly if those poos are looking dry, looking like little pellets, I would be concerned that they are constipated.
Okay. All right. And that's something to be talking to your health professional about, so your doctor, because that's a really important thing, especially when they're little. That's something that, we don't just go to the chemist and, anything like that over the counter. No, you are going and speaking to your GP or your paediatrician. Really, really important.
Yeah, and the tricky thing, Sarah, with the little ones is that they can often look like they're constipated because they strain, and they get that red face and they grunt and, they go totally, exactly. And that does not necessarily mean that they're constipated. Often it's just, them learning their bodies and developing the ways to pass emotions. So again, many pieces to a puzzle to working things out.
Absolutely. And I think that's I remember being with my husband and watching our first child poo. She would get the same look on her face every time. You'd know when she was just about to, because she'd get this look on her face and you go, yep, here we go, about to poo. Very, very funny. So we've talked about the newborn stage, and we've talked about, generally what normal can look like there, and it is varying things. What about when we start to introduce solids? How does that change with our baby's poo? What are we expecting then?
first of all, a lot of babies when they start solids will actually have a period of constipation.
Okay.
And what are the signs of constipation? We're talking about new onset of straining, considering we've just mentioned that before. It could be a lot more smelly wind, and then actually looking at the poo itself, less frequent bowel motions, as well as harder, drier bowel motions. So that can be those typical little rabbit pellets that you may have heard of. They can be all stuck together. And I'm not going to talk today about things like overflow and soft poos with constipation, but I'm very happy to do a chat just on constipation, because I think that we could get lost in that kind of like rabbit hole of constipation.
Yes, absolutely.
Yeah, but otherwise, other than getting constipated, babies can also get runny poos depending on what they're eating and how their body's responding to it. Or, very commonly, they can also get bits of food in their poo, and again, a question I'll get asked is that normal? Does that mean my baby's not digesting their food? And the answer is no. It means your baby's probably not chewing their food, which is entirely normal. Young children, and this goes in toddlers as well, it's entirely normal for them not to properly chew their food as we should. We're meant to chew our food multiple times. That's where digestion starts. And I see Sarah was trying to bring up a Bristol stool chart there.
I know. I thought I was going to be really sneaky on the side and then do that, but it didn't work how I wanted it to. So I'm going to have to perfect that a little bit better.
Or we can always share the link or an image. So that what Sarah was trying to pull up is something called the Bristol stool chart, which you can Google. Even though I don't like Google, I think it's fine to Google this because you're looking for something specific. And what that is that gives you there are 5 different types of poos. It is 5, isn't it? Now I've had a moment thinking it's 6.
Yep.
Oh no, that's not right. That's not 7.
No,
anyway, their number of poos, and basically what you're aiming for is that well-formed but well-formed soft stool. That's what you're looking for in a child in terms of it being normal. So that's when they start solids. And then, I guess the next big time when we see changes is during toilet training. And again, the big thing is that they often get constipated because they're holding on. They're learning how to hold on, which is appropriate. But then they also either are holding on at the wrong times, they become fearful. I mean, that can be a whole other lot of potential issues there with toilet training.
Yeah, no, absolutely. And that can be a real problem. Once again, it's one of those things where it rather than just waiting and all the rest of it, if you are identifying the issue, please go and speak to your health provider. It's an important thing rather than letting it be a problem that goes on and on and on. And of course, as Deb said, it is that puzzle that needs to be put together. So we've talked about newborns. We've talked about introducing, when we introduce solids. What about the toddlers, especially when we're heading around to the toilet training time, all that kind of stuff? What are we expecting then?
Well, as I mentioned, the most common thing that I would see would be constipation. So again, it's watching for that. The other thing I often see is, obviously, this is also the time when kids will often get gastro quite a lot, because, preschool times. So the poos can certainly change when you have gastro or any viral infection. I think I'll just state that as well. When a child has a snotty nose, even it can make their poos quite loose and sloppy because all the snot, they're swallowing it. And so then that alters their gut habit as well. So those would be the typical. The other thing is that there is this entity called toddler's diarrhea, which is the diagnosis that your doctor would make. And it's a diagnosis by exclusion, really. So if your child has ongoing diarrhea, what we would do as practitioners is exclude any pathology, any physical causes, and obviously look at any dietary causes as well. And there are lots of causes of runny poos in terms of children's diets.
Yeah, absolutely. So, it's incredible to think that something as simple as poo is incredibly complex in reality, to be honest. So we've talked about what's, tends to be normal and what kind of deviates off that a bit. But Deb, what are the red flags that you worry about when it comes to kids' poo? So when, regardless of, what age it is, what do you worry about? When do you think people need to seek medical help?
So the first thing that I would say is that delayed passage of meconium, and that's that delayed first poo should be within the first 24 to 48 hours. So that is definitely number one. Number two is a white poo. Any white poo is abnormal.
Yep.
I'd also be cautious of poos that consistently float and don't flush.
Okay.
That means they've got a high fat content and they're not absorbing it properly. The other thing to look for is mucus and blood in the poo. Mucus in the poo, yes, it can just be from swallowed mucus, but it can also indicate that there's a degree of inflammation in the colon. Typically in very young babies, that would be something like cow's milk protein intolerance, but it can also indicate inflammatory bowel conditions, Crohn's disease, ulcerative colitis, which usually present when children are older. The issue with blood is that blood can either be fresh blood, which is that bright red, obvious blood, and that can indicate either some local issue, like a tear, maybe your child's being constipated, excuse me, and they've had a little what we call an anal fissure, which means that as that hard poo is passing out through the bottom, it just tears a little bit of the skin around the bum, and that bleeds a bit, and then you can get some blood on your poo there. It can even be some children with chronic constipation or other medical conditions can have hemorrhoids like adults can have, you know, or again, it could be inflammation in the gut, like the colitis, cow's milk protein intolerance. So, you know, so those are all looking at the fresh blood. I'm just giving a few examples. Altered blood or old blood also makes the poo look quite particular, and that causes something called melena. And that is a very particular poo. Sarah will know exactly what I mean when I say if you've seen it once, you'll never forget it.
Or smelled it.
Exactly what I was going to say. It's got a very bad smell to it. It's a very dark black color. So that would be another alarming kind of poo. But, you know, the overall message is if there's any significant change in your child's poo or general health, obviously that's something that needs to be looked into.
Yep, absolutely. And, you know, it's such a reflection of our health is how we are pooing. It is definitely something to pay attention to. And the other thing as well that Deb was talking about as we started this Facebook Live is that you need to be able to show your doctor what the poo looks like. So rather than saving it in the nappy, taking a photo is absolutely fantastic. Being able to, you know, get a really good image to show your doctor speaks 1,000 words. So that's a really, really good thing. And of course, often a doctor may actually ask for a stool sample. Make sure that you actually understand how to collect that as well. I know in the past that sometimes I've looked after patients who've been instructed to get a stool sample but haven't been told how to do that. Ask the question about how to collect that poo, okay? Because it's not as, sometimes it's not as easy as what it looks. So make sure that you do ask that because it'll make your job a lot easier as well. So
that's something. So I was going to say, I think I've actually got a reel on that. I'll have a look and see.
Deb, really?
I'll have a look. I forget what I've done.
Ooh. That would be fantastic if you do.
Yeah.
Yep. Very good.
Carry on. Sorry.
Okay. So, because it can be a bit of an art form to be able to catch a poo, just like catching a wee can be an art form as well.
Oh, exactly.
So, we've been talking to you all about poo today. If you have any questions, please pop them in the comments below. Now is the time to do so. And the other thing that we want as well is that if there is another subject that you would like us to talk about, as Deb said earlier, please just DM us, myself at CPR Kids or Deb at Dr Deb Levy on Instagram. Please make sure you let us know what you want us to talk about. And remember, oh, here we go. We've got a question from Edina. Edina has said, hello, could grey poop be caused by blueberries? That's an interesting question.
I don't know the answer to that. I must say, Edina, you know, my rule is if we think it's from a food, keep a poo food diary. You know, if it's an intermittent change in color, I wouldn't be worried. But I mean, in gray, then I'm starting to worry about white poo. So obviously, I can't give specific clinical advice on this. But I would say, if you're noticing, you know, within the 24-hour period after eating, blueberries at your child's poo is great, it is probably from that. But I can't think of any, excuse me, chemical reason. Just as an interesting thing, obviously the other thing I didn't mention about it with food is that beetroot, if your child eats beetroot, it can actually look like blood in their poo.
Yep, exactly. No, that's exactly right. We've been there and done that. And, I knowing it was beetroot, but my child at the time being really, really upset because she'd eaten some beetroot and pooed and thought that she was bleeding from her bowels. I had to reassure her that it was okay, that it was just beetroot, bless her. And the other things as well to be conscious of, I mentioned bananas before. So we've had lots of parents ask us the questions about bananas in their poo, whether those squiggly lines are worms, but it's actually part of the banana fibers. They can be red or a brown color. That is completely normal. They're just tiny little things like that. And the other thing is sultanas. We did a post on this recently when one of our lovely CPR Kids team members, her little one did some big poos of some rehydrated sultanas that looked exactly like whole grapes. And so her daughter just didn't chew. She just shoved them in and swallowed them down. And so she ended up with these nice big grapes being pooped out. And the first thing she thought of was, oh no, daycare's not cutting the grapes. But then she realized quite quickly, oh no, they are cutting the grapes. She just didn't chew her sultanas. So be aware of that one as well.
And corn, you'll inevitably see corn in baby and all poo because we don't digest it. We don't actually break it down.
Yeah, exactly. That's it. And I know it's incredible. And it can be a little while later as well. You're like, surely you had corn, when did I feed that to you? So it's a funny one. But anyway. So I think that might be the last of our questions, Deb. So we might say goodbye for today. And remember, take photos of the poo. And if you are in doubt, please seek medical help. Thanks, everyone. Bye.
Thanks. Bye.